All right. I'm back. And today we are talking with Miss Dee Reid. And Dee is the CEO of Amplify. And I am so excited for you all to spend time with her because she's going to talk to us today a lot about treatment presentation, give us a few pearls, but not until we hear a little bit of her backstory. Because if you're going to take advice from an expert, you want to know that they're an expert, right? So, Dee, take it away and give them your expertise.
So I started in dentistry in 1989 as a fun after-school job working for an endodontist, and thought that was really all it was going to end up being. And then over the years, I grew into, from being a dental assistant to learning the business side of dentistry, which was really super fun for me.
Okay.
That's like where things were clicking for me. And then for 18 years, I did voluntary work for a transformational company doing leadership development. And my dream was always taking the skills that I learned in coaching leadership and bringing it to the dental world. And about 14 years ago, that's where my coaching business started. Um, you were one to help push me in that direction. You were like, "You're not published yet. We're getting you published." And I'm
Do
like,
some stuff.
"Yeah." And I'm like, "Get out of my comfort zone in a hurry." And that's kind of how my business started. Dr. Mark Montgomery, who's my partner in Amplified Dynamics, he said, "We're doing this and you're going." And he introduced me to a group of doctors as this consultant who I didn't even have a business card at the time. And
Sure.
he was like, "You philosophically, you are clear on what it takes to have a patient move from ambivalence into action, into a yes, into a relationship." And that's where the fun is for me, is like dialing down the stress levels for doctors and teams and making it easy, making it fun. Like we have such an honor to be able to take care of patients, and the only business I know of that we get to take care of not only the patient but their entire family and their extended family over the course of many, many years. Like, who gets that as their profession? That's what, and it's like we get to take care of our community in a way that is super special. And so, why not get the goodies? So I think this is what most doctors are missing out on. They miss out on the goodies that if we are in relationship with people, what we get back from them as we give to them. And because we got to, get on with clinical or whatever, it's like we've got to hang in the relationship, because that's where the juice is. That's where the de-stressors come. But we have to make an effort at it. What I have found, I do work with dentists all over the country, but I also have a little part of my business where I work with an engineer, and he's
very cool.
a business owner, and I work with some physical therapists as business owners. And it's interesting how most dentists and engineers, kind of live in their left brain, logical thinking mode, and are sometimes afraid to go into the creativity, lovey-dovey, mushy love stuff.
And fill their cups, right?
Yes. And so it's like they're missing out on those kind of yummy interactions with patients, and to have the patients go out and be raving fans because we took the time to know them. Right. It's often that I'm on planes and flying from, client to client. And when people sit next to me and they ask me what I do for a living, they're like, "What is it?" And then I'm like, "Tell me about your dentist." And they're like, they either love their dentist, or they don't know who their dentist is at all. It's like there's not really an in-between. And it's like when they love their dentist, I want to know why. What is it about that relationship that's special? And the things I hear over and over is they know who I am. They know my kids. They know what my kids do. We are connected. They know me. And so I think there's so many doctors that are on roller skates. Granted, I get the pressures in the office in order to be profitable these days. But it's also, what can we do to, I think we can do more dentistry on less people and have a higher job satisfaction, career satisfaction, if we take the time to really dive in and listen.
And
So,
that's what they did in dental school, was a whole lot of listening, a whole lot of intake. And
yeah,
then as dentists get out of school, or hygienists or assistants, it's like all of a sudden I'm at go,
yeah,
and they're not doing it the way I did it in school. And oh, we're not taking blood pressure, we're not screening for oral cancer anymore, and we're just saying, is this normal for you on your medical history? And we're forgetting all those big relationship builders
right.
that actually give us a solid foundation for a discussion, right?
Right.
Like,
Medical history is one of my favorites
my
to
favorite.
use as a tool to get into deeper conversations versus, like, my partner, he at the front of the room, he will do a live demonstration of going through a health history.
Sure.
And he'll do it the way not to do it. It's like, oh, you have cancer? Okay. You have high blood pressure? Okay. Oh,
Yeah.
you had 2 strokes? Okay. Like, and no follow-up questions. No, like, what happened? Like, tell me what's going on. Is this under control? Like, what are you doing? Like,
or even the better one that says, is everything right on your medical history? Yep. Okay.
right.
One
And they
swoop. Haven't seen you in a whole year. Haven't seen you in 18 months. Haven't seen you in 6
I
months.
don't even remember
Everything
what
good?
they put on
Yep.
it. Yeah.
I did my job, but there's so much more. I love, Dee Dee, one of the things that I know that you do well is the deep dive into the connection. And it does start with medical history, because that's like your window into everything. So Dr. Montgomery gives his example of, this is how y'all do it, this is how not to do it. And
Right.
then we go through, this is how to do it. And you're just the shining star in how to do a great medical history interview and build off of that relationship. So give
So
me your example.
it's our job to connect the dots.
Yes.
So, and to help patients connect the dots. Our job is to help them make a good decision for them.
Yeah.
So if we take the health history and we're seeing high blood pressure, we're seeing they're on sleep medication, we're seeing that maybe they're on erectile dysfunction medication.
Yeah.
It's like, okay, let's connect the dots here. Could they have a sleep issue? Yeah.
Or
like,
when did this start? How
tell
long
me
have
about
you
your
been on
sleep.
these medications? Because those dots are connected to something going on in their life too, that all of a sudden when they put those pieces together, they start going, I have a problem, right? Yep.
Yeah. And it's like, has anyone taken the time to talk you through this? And then asking more questions. So that's probably the biggest thing that I see, that I see that when things go wrong is where doctors are used to being the answer person. I've got all the answers.
Yep.
And I like it if doctors have all the questions. Like, the person who asks the question controls the conversation. So if you are asking questions, you are leading the conversation and helping patients get to a possibility. It's our job to get to know them deeply and know, where are they in their life? What are they ready for? What are they on hold for right now? They're caring for a sick parent who has dementia. They have 3 kids in college. They, just going through a divorce. It's like all of those things show up in the mouth.
Yeah.
We see it all the time, bleeding gums and rampant decay because they haven't been taking care of themselves.
And we start talking about, we have to still lay down the foundation for planning. What's coming down your pipeline? What's going to happen to you over the next few years? Even if you have a dying, sick grandmother that you're caring for, that doesn't mean like, don't talk. That means the conversation needs to be, I need to expose you to some stuff. I need to have some conversation with you. And we together can make some good choices, knowing where you're at in your life.
And how to manage them during these times in their life, so that when they're ready, when we're ready, when it's the right time, then we're able to do what we need to do. And sometimes now is the time. But it's
Right.
like, are we sensitive to what it is they want their future to look like? Do they want their future to look like their past? That's a great question. Do they want, what are they most worried about when they come to the dentist? What I hear often is, every time I go to the dentist, I always have something wrong. And I'm like, would you like that to be different? And they're like, is that even possible? Yes, it's possible. We can create a plan for you that takes that into consideration. We can give you a clean slate moment. Right now, you got a lot going on.
Yeah.
But we have a way to give you a clean slate moment. Once we get this healthy, then when you come in for hygiene, we're high-fiving, babe. Like, this is a fun time. We're hugging, we're high-fiving, and things are good. And you can walk through our doors and know that you are in a stable, healthy condition versus having the worry in the back of your head, in the back of your mind, that what's now, what crazy thing are they going to tell me this time that's wrong? I think that's another thing that we could do better is we use a magic explorer, and the explorer is always looking for things that are wrong. Stop it.
I think one of my favorite training programs that I grew up on in dentistry was Prime Speak. And Prime Speak is a whole lot about, we have to expose, we have to deepen people's concerns about their conditions, but we also have to celebrate what's going well and build a positive environment for the patient, because that customer's buying from you, and you don't want them walking out going, everything's crap and my last dentist did nothing for me.
Right.
I love telling people, when they say, oh, every time I go to the dentist, there's another problem. My goal is to prevent that from happening. But oftentimes, and I'll explain, dentists, they will tell you when it's broken. They will tell you when it needs to be fixed immediately. And every dentist has their own eyes, their own system that they work off, and their own relationship with you to determine, when you're ready to fix things. So it's not that every time you showed up there was something wrong. It's that you just didn't get the whole map at one time. So we want to give you a map so we can kind of go together on this. Mm-hmm. I want to be your last dentist that you ever come to.
Right.
When people leave their dentist, what are they leaving for? Right? Mm-hmm. So did I relocate or move? Yeah. Those are normal things. But if somebody says, I didn't like him, or this problem happened, right, I'm like, okay, we can help to overcome that problem. Yeah. And we'll do better. We'll do better for you. But talking about relationships and talking about building your patient base and your clientele, you're really building it off of people who want to be there, who are in your community, who found you, and they've already made the first big move, which is saying yes to an appointment.
Yeah.
You didn't call them, they called you.
Yeah. Walking across the threshold is sometimes the hardest thing. And so are we honoring that choice when they walk in our doors? Are we embracing them with love and compassion versus judgment?
Yeah.
I mean, it's like they are there for your healing. So I have a quote I wanted.
Ooh, I love quotes. I love it. When Dee Dee comes up with a good quote, I'm ready.
Nerdy self.
I love it.
This comes from Harrison's Principles of Internal Medicine.
Okay.
The patient is no more a collection of symptoms, signs, disordered functions, damaged organs, and disturbed emotions. The patient is human, fearful, and hopeful, seeking relief, help, and reassurance. That's our job.
Yep.
How can we reassure them that they're in the right place? They've made the right choice. How can we give them hope that their past doesn't have to look like their future? How can we help them along the way to listen to where they are in their life right now, and paint them a new picture of what could be possible? That's why I love taking photos with patients and talking about them. It's funny. I've taught photos for years.
We love
And
photos. We love medical history and photos. So now we know that
those
Judy and
are
I
my
have
two.
two things in
Yeah.
common already: medical history and photos. We love that because it really creates conversation, and even for the most introverted person, there's conversation. You can't not want to talk about these very important screenings because they're about you and
Right.
you're doing them with you. So we're kind of co-exploring,
Yeah.
co-finding all the things together. So it's not Dee Dee's fault.
Right. Right. I'm here to help you.
Yeah.
Like my job is to help and to give you some ways forward. And that's our job.
Yeah. I'm
And
your
to do it
coordinator of care.
right.
I'm your advocate of care. There's 100 names you can call us, but basically we're here to help you get what you want.
Yeah.
Yeah.
Right. Being their patient concierge. That's why I created Patient Concierge Institute, is to help teach our teams how to un how to
Undo
unravel
all
all
the bad things we
yeah,
learned for
yeah,
years.
to
Yes.
get the information from patients that's vital to us designing a plan, not having a plan by default, but actually
Right.
designing it based on what we know about the person
Yes.
so that their future is what they prefer.
Absolutely.
That's where the fun is. Like I
Because
feel like dentists are missing out on the fun part
they
of what
are
we
missing out on the
do.
fun part.
And because we jump too quick to getting in the mouth doing the exam without having a decent conversation prior to putting gloves on.
Yeah.
And how, how does that happen? I get it. We're rushed. We're in a hurry. We're trying to get you've got two hygiene patients waiting for you and two patients in the chair. So that's why you employ your team to get these things out of patients so that you can use them to take better care of them.
I tell every dentist, and I know you've heard this before, the 3Ds: you're good for diagnosing, you're good for drilling, and you're good for dreaming. You can delegate every single task beyond that to any team member in
Yep.
your office that's qualified. But when we start digging into what our supporting team can do, those are our real business partners. Those are the ones that are really excited about taking patients from unhealthy to healthy, excited from taking the journey with the patient for a smile transformation, or if they're getting a sleep appliance and they're magically changing their marriage or their personal life. I mean, that transformation to me is woo, that gets you on fire
Yeah.
when you start having those big moments with patients. And a team member, whether you're doing a filling or whether you're doing a full mouth, it's really those connections are those that's your community too, because you live in this community. That's your referrals too. And so many times we think of ourselves as less,
Right. I'm just a dentist.
or
Right.
I'm just an assistant. I'm like, let
Right.
me tell you what I do for a living.
Yeah.
Let me tell you all the things. They're like, that's the hardest job ever. I said, sure is. But it's the most fun because you get to have those great conversations. You get to take photos. You get to do medical screenings. And you get to be help those fearful patients or those stressed patients or those least trusting patients to learn to do it again. So
Yeah.
you
How do we
are,
make a friend? How do we make
yes.
a friend out of the people that we're serving?
I
If
tell,
if we see it that way,
yes.
it turns to magic when we are willing to go there.
Yeah, I tell every team member, I'm like, imagine your dental practice is your home. And each person that's coming to your chair for the day is coming into your home. How would you invite that friend into your home? How would you care for them? How would you treat them? You don't leave them. You don't forget to say their name. You don't forget to have your tray ready or to know a little bit about who they are, where they came from. You don't walk in blind when you open the door and you're like, I have no idea who you are. What's your name? You really come on in, Barbara, come on in, Dee Dee, come on in. And you make them feel like your family.
Yeah.
And that in
Like you're
return,
your favorite person on the
yes.
planet. It's like, how would you want to be treated if you're the favorite? It's like, yeah, do we pull out pillows and blankets and, give them the red carpet, even if it's a filling appointment? It's like, it doesn't matter, because if we think about who does that person influence in the world, we can't take any relationship for granted,
No.
because the smallest procedure we do with a patient can turn into the largest referral source in your practice. And it's like, how did you make them feel when they were in the practice? Those are the things they will talk about. It's not about, oh, he the margin of that crown was sexy, awesome.
Nobody knows it
Never
but
gonna
you
say that.
and your dental assistant.
It's like, how do we have this relationship that is remarkable, that they want to leave and go, wow, that was an incredible experience? That's what I think about when I look at a schedule of patients. It's like, how can I create a remarkable experience for this patient today? Where are they coming as a new patient? Where are they coming from? Why are they here? Why now?
Well, Dee Dee, we agree on this. We also agree on the fact that, like, you think about the worst experience you've ever had, the worst medical or dental experience, and you say, I refuse to let this happen to any patient sitting in my chair or in an office that I coach, because I physically experienced it. I think that's what is so incredible about coaches is the best coaches are the ones who have experienced so much, whether you were experiences on the inside of the practice or the outside coaching people through. I mean, my 25 years have been, there's things happen in my 25 years that people won't have happen in their lifetime, but but they're all there because those experiences give you great boundaries, great perspective, so that you can guide and say, let's never let that happen, or let's do it different, or let's do more of that. So you're a big believer, medical history screening, really spending the time on that. Photos, like every patient, that's an update. We update photos every single visit. There's something to take a picture on, whether you're scanning and your pictures are showing up, whether you're taking your your big camera and taking digital photos, your iPhone, whatever, an intraoral camera. It's the picture tells the story. So if you're the most introverted team member, you should be the best at photography, because that photo you put on the screen, your patients will talk your ear off and you won't have to say anything. Right. Other than, I see that.
Take notes and know what the patient listens.
Active listening. I'm just going to write all this down. Miss Dee Dee, let me write all this down.
Right.
I'm going to make sure that, I'm going to make sure that me and Dr. Montgomery talk about this when we bring him into our conversation. These are very important pieces of information for him as he's helping us create the plan for you. So easy to do, but yet so complicated sometimes for team members, because whether it's fear of getting going and trying something different, or social acceptance. Nobody else in my office is doing it, so if I do it, they're going to all think I'm crazy and weird. Right. Those are all reasons to not do it, but the reasons to do it is as simple as you just want better for yourself, and you're a patient, and if this office does better, then every single person that walks in gets better, including yourself. Yeah. Right?
Yeah, the first thing that I talk about with patients is like, what results plan are we going to create for you? And results plan may look like, I don't ever want to have dentures like my mom. I don't ever want to have a root canal, or I don't ever want to lose a tooth, or I had a patient tell me, I want to be able to flirt with my husband. I've lost my
Sure.
mojo. I don't smile. I don't flirt with him. And so that was her result plan. Is like, we want to get her on the path so she can flirt with her husband again. Like, that's the emotional connection
Yep.
in that results plan. I don't want to have dentures like my mom. Why not? My mom struggled. It's this, it's that. It's, she was embarrassed. I mean, it's like all these things. When people have the emotional connection to what results they want, it could be as simple as, I don't want to have something wrong every time I walk through the door.
Mm-hmm.
It's like, I don't want to have that scared, unsettled, fear of the unknown feeling when I walk through the door. It's like,
So what's he gonna find, Philly?
To get to the heart of that and connect it emotionally with a patient. It's not, hey, I want to have crowns on all my teeth. Like, nobody walks in asking for that. If they do, we're gonna send them to the psychiatrist. But like, they come in because they want what we do in their life, not what we do while we're in the office.
Not what we do in their mouth.
They want the result of what we do so that their life can be different, better, enhanced, lack of worry, all of those things, so that they don't think about their mouth. They don't think about their jaw pain. They're not thinking about, oh, I can't go to lunch with my girlfriends because my upper denture always falls out and it's embarrassing. I can't eat in front of people.
We tend to think that many people in dentistry tend to think that dentistry is a need and it's necessary and everybody has to do it. We don't tend to look at it as one. It's optional.
Everything we do is optional except maybe one or two things that could lead to sepsis,
Yeah, but it's optional. It's discretionary, and people have to want it. I don't love going to physical therapy. I've been to physical therapy in the corporate environment where this is what you do. It takes 30 minutes to get there, 30 minutes to get home, and you got to stay an hour and you got to be in a group with all these people. No fun, right? You're a number. They don't know your name. They don't remember what exercise they did last time. And you get such negative vibes that eventually you feel hopeless and you just stop going, right? I can do better doing it on my own. Then I've done where they treat you like family. They say your name multiple times. They build relationships, and they even like come to your house or whatever. That is a very intimate relationship, and especially when you are broken, hurt, and weak. So you truly develop a lasting relationship, a bond, right? I can remember everything that happened when I fixed my teeth. I remember because I was bonding. I was in that trench with someone and I was emotionally dependent on them. And that right there is what is happening in dentistry. Is if we treat people well, they do become dependent on us, and they want to go through a process that's unknown, uncomfortable, that's super intimate, and they want to have that person to tell that stuff to, if there's somebody that will listen. So when you see people with dynamic smiles or life-changing stories and you ask them about their practice, they know people by name, they talk about the team members that help them, they know the dentist by name. No one having comprehensive work done goes, I don't know his name, her name, who knows? Right. They don't. Because these people show up when there's a relationship built, when they feel they can trust you with this intimate information for you to work from. Yeah. So if you come in guns a-blazing, I told Dennis, if you come in guns a-blazing, you roll up in, big voice, in a rush, standing, leaning against your table, kind of distracted, that's what you're going to get from the patient. When you come in engaged, excited, wanting to hear what all was shared, prior to your exam, that's when you're going to get the goods. That's when you're going to really get the connection. And that's when you're going to have fun.
Right.
Like, you might not call fun, oh, I just love exams. But what you do call fun is, I really enjoyed that person in my chair today. They didn't annoy me. They didn't, say rude things. They didn't talk about things they're not supposed to talk about. They didn't jump out of the chair when I touched them,
Yeah,
because you built a relationship.
Because we created the relationship.
Yeah, and you knew beforehand.
Yeah.
You knew beforehand if they didn't want you to touch them because of that relationship. So I love how you teach your teams. I love how you share your wealth of knowledge, and I really, really love the years of experience that you have doing this and really showing those incredible results. So what's something that you could give a dentist or a team member? I love team. That they could start implementing Monday morning, that really could say, oh, Dee Dee taught me that. Oh, Dee Dee reminded me I needed to do that. This is working.
Asking questions, asking things about who they are, what matters most to them, and what do they want their future to look like. It's like, how do we get into that conversation? And because that's what's going to change the relationship with you.
Yeah.
100%. It's like, how do we care and be honored that they have chosen us?
Yep.
To be a part of this journey for them. It's like we're walking hand in hand, shoulder to shoulder down a pathway that is to help for them, whether it's we're sprinting together or we're taking baby steps. But it's about asking those questions. What results do they want now? Why are they here now? This disease didn't happen overnight. Right. It's like, what motivated them to come through our doors today?
Yeah.
Like, and I asked that on the phone call. What inspired you to call our office today?
Yes. So if I'm a team member, okay, so I'm your RDA, and it's Monday, and I have it in my head, I'm going to ask more questions. I think my coaching advice, which is probably similar to yours, is, hey, look at your charts beforehand, review your notes, and set up your appointment differently with a patient. If every single patient's scheduled exactly the same on Monday, it's okay. You are the one who has to change first.
Right.
You have to be different. So set your appointment up and tell the patient what they're going to experience today from you. What do they get from you? Right. They're going to get a different experience. Mm-hmm. Tell them what we're doing. I walk into practices all the time, and people don't even say what we're doing today. Oh, we're going to take some bite wings. We're going to take a pan. We're going to get an exam. Right. And we're going to do this fluoride treatment, and we're going to clean your teeth. Well, I don't want that treatment. Oh, okay, I'll tell the doctor. And they just boop, 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 and run down the grocery list instead of, hey, here's what we're going to do. We're going to review I want to review what happened at your last appointment. We review it. I want to talk about what's going to happen today. We talk about why we're going to review the medical history, not just we're going to review, but why, how we're going to connect those dots to what's happening in your life. We're going to set some new goals. Right. Maybe we've never done that before, but I want to do that with you so that we can start having different conversations about your mouth. Miss Jones, you've been coming here. I'm looking at your account. Well, heck, you've been coming here longer than we've been digital, I think. And that was in 1989. Whatever. But right. But you do those things. Now you are changing everything that you do by actually setting up the appointment differently and being a little prepared.
Because it's patient-centric. It's all about the relationship first. And yeah, it's like
not about the time. Not about it's 9:40. We haven't started prepping these teeth, and I have to be out of here at 10:10. It's about the patient.
Yeah. How do I give true caring, health caring? It's not just healthcare. It's how do we bring the caring to the party?
Not just I said I cared. Doesn't that count?
Yeah. No. It's like they need to be able to feel you. And it's like, how do we get to know them in a way that has them trust us, like us, want to be here, and know that we love them. It's
like, so Monday morning, more
sprinkle the love in.
Yeah. Monday morning, more questions. Monday morning, pull out, dust off that camera, pull out that
Yep.
camera and take some pictures, even if it's just intro pictures during a procedure, right before the procedure, while you're waiting on your doctor. Take them.
Yeah.
Be different with your tools and your technology.
Use
And
the
then
health history as a super insight to your patient.
it's like
How
the
to help
CSI investigation going on. How's this connected to this? Yes.
our job is to connect those dots.
And Dee Dee, if they need training about treatment presentation, how to get better at it as a team, or if they need leadership training or total coaching, how do they get a hold of you?
They can get me on amplifieddynamics.com.
Fabulous.
I'm on Facebook, Dee Dee Reid on Facebook. Like you can find me there. It's like how do
Awesome.
it's like get a hold of me just for a conversation. Let's talk
Yeah.
about what it is that's making you crazy and how do we remove that obstacle so that you can get the joy that you deserve.
Yeah. And it's not always about more patients. Sometimes it's about less and figuring it out. So, Dee Dee, thank you for our conversation today. I think it's fantastic. You bring a lot of insight back to the very beginning of appointments and why it's so critical to talk and have conversation and build great relationships. Along with that, Dee Dee's been doing this gig for many, many years of growing businesses and making them lots of income to support not only the doctors but team members, right?
Yeah.
So
Yeah,
reach out. She's here. She's available, and she loves questions.
definitely.
Thanks, guys.
Thanks, Hollie.